The Change Foundation is Ontario's healthcare think tank, a think tank with a clear goal to make a difference for patients in Ontario. The healthcare system uses many different terms and phrases to describe their priorities. Patients can sometimes feel overwhelmed. We began this journey by reviewing literature on healthcare system transformation and integration, and we noticed a big gap. None of the literature brought forward the voice of the patient. We quickly understood that to truly improve the patient experience, we needed to understand it better. So in 2010, we released our Hearing the Stories, Changing the Story strategic plan. We wanted to facilitate the creation of a made-in-Ontario patient engagement approach that we could all learn from. We put a call out to the Ontario healthcare community interested in improving the healthcare experience for seniors in their communities. We received 27 proposals from across Ontario and narrowed the list down to 5. We visited each community. We listened and learned. We selected our partner. Partners Advancing Transitions in Healthcare, affectionately known as PATH, was born in Northumberland. PATH brought together 12 organizations in healthcare, community care and patient advocacy to work as partners with patients to improve healthcare experiences in Cobourg. They set about bringing in the experts, the patients, and their family caregivers. They started by listening, really listening. Collectively, we wanted to truly understand how the system, with all its quirks and disconnects, impacts the lives and health of patients. It wasn't long before the system was watching and listening. Former Health Minister Deb Matthews credited PATH as the catalyst for the province's fast-expanding Health Links model that creates wraparound care for Ontario's chronically ill seniors. PATH's chosen quality improvement approach? Experience-based co-design, because it puts patients and family caregivers at the heart of healthcare changes in their community. The community got involved. 39 patients shared their healthcare transition stories to inform the project. 120 patients and caregivers are using mobile technology to improve their healthcare experience. 15 senior patients and caregivers created the RISE team, Respect, Information, Support, and Empowerment, who are critically involved in all aspects of the project. 31 volunteer peer coaches, 190 healthcare providers. 4 key priorities were identified. First, an online community resource that empowered people to plan for healthy aging and centralizing the local resources. Second, integrating and embedding a person-centered approach for the health and community care partners in Northumberland. Third, providing help for patients with transitions through a peer approach. And fourth, introducing mobile technology as the primary source for each patient's evolving life and health information, and a real-time communication tool between patients and providers. The project has had an impact on the mindset of the local healthcare community. Patients have been engaged in the redesign of the emergency department's processes, the chaplaincy program, the emergency department quality committee, a quality team looking at falls, mobility, and least restraints, a review of acute inpatient experiences. What does healthcare look like in the Northumberland community now? It's a community in Ontario where patient experience data is collected in real time. It's a community where patient and family caregiver engagement is the norm. It's a community that has embraced technology as a key enabler to improve healthcare experiences. It's a community where the patient and healthcare provider relationship is setting a new standard in Ontario.